Buoy Health Insights, Knee Numbness. Welcome to Buoy Health Insights, where we delve into common health issues and explore what they mean for you. Today, we're discussing knee numbness, a sensation or lack of sensation that can be concerning for many. Numbness in the knee is often tied to problems with your nervous system and can be accompanied by other telltale signs. If you're experiencing this, pay close attention as we break down the potential causes and the symptoms that may hint at the underlying issue. When you experience numbness, it means that you've lost the ability to feel things as you normally would. Sensations like light touch, temperature, and pain become dim or entirely unnoticeable. Normally, these sensations are sent from the knee up through nerves to the spinal cord and then to the brain. Specifically, the sensory signals from your knee travel through a nerve called the femoral nerve. Now, knee numbness is primarily due to problems with the nervous system, specifically when there's damage to the femoral nerve. But there's more to it. The sensation is complex, and conditions that don't directly interfere with the sensory pathway from the knee, such as psychological problems or chronic pain syndromes, can also affect the feeling in your knee. Let's dig into some of the characteristics of knee numbness and related symptoms. You might experience tingling, pain in the knee, leg, or back, numbness in other parts of your leg or in your arm or face, swelling, weakness, and even muscle atrophy, which is the wasting away of muscle tissue. Each of these symptoms provides a clue about what might be causing your knee numbness. For instance, issues with the femoral nerve or its branches. This can mean direct injury or compression, which might happen after something like a knee replacement surgery or from conditions like diabetes. Arthritis. This condition can change the way sensory receptors in your knee work, making for unusual sensations like numbness or tingling. Damage to the nerve root. The nerves that give sensation to your legs come from roots in your spinal cord. When these roots are damaged, you may feel numbness along with other changes in sensation. Injury to the spinal cord. Such an injury can result in losing sensation below where the injury occurred, which might include your knee. Brain damage or stroke. Damage to the brain, like what happens in a stroke, can cause loss of sensation on one side of your body, including your knee. Conditions like fibromyalgia or psychological factors can also lead to what feels like numbness in various parts of the body without actual physical dysfunction. So, when should you seek medical care? Here are some red flags. If you have sudden numbness following a possible stroke, this is an emergency. Symptoms like sudden severe headache, new weakness or numbness on one side of the body, confusion, or trouble with speech require immediate medical attention. If you notice weakness or numbness progressing rapidly, especially if accompanied by low back pain and loss of bowel or bladder function, this could represent cauda equina syndrome, a rare but serious condition affecting nerve roots in the spine that requires emergency medical evaluation. For spine-related issues like spinal stenosis, which is a narrowing of the spinal column that might press on nerves, seeing a primary care or orthopedic physician is the next step. They might consider imaging of your spine and suggest different treatments ranging from medication to physical therapy or even surgery for severe cases. Remember, diagnosing these conditions involves a detailed medical assessment and sometimes imaging studies or other tests. And treatments can vary depending on the cause. In conclusion, if you're experiencing numbness in your knee, consider the other symptoms you might be experiencing to get a clue about what's going on. Always consult a healthcare professional to get the right diagnosis and treatment plan. Thank you for joining this session of Buoy Health Insights. If you found this information helpful, please like and subscribe for more health topics and insights. Stay informed and take charge of your health.